Hello everyone, my name is Dr. Rosha and today I'm going to talk about scapula. The scapula is a triangular flat bone located on the posterolateral aspect of our rib cage through ribs 2nd to 7th. The name scapula is derived from a Latin word meaning a small shovel to which it resembles. The prefix omo, which is a Greek word, is used to describe the shoulder blade in anatomical terminologies. This bone is important because it serves as attachment site for 17 muscles of the arm and shoulder region. Along with the clavicle, it forms the pectoral or shoulder girdle, which connects the upper appendicular skeleton to the axial skeleton. It has the following presenting features. There are two surfaces, the costal surface or the ventral surface and the dorsal surface. It has three borders since it is a triangular bone. This one is the medial border, the lateral border and the superior border. It has three angles, the lateral angle, the superior angle and the inferior angle, and it has three processes, the spinous process, the acromion process and the coracoid process. For determining the side of the bone, we need to consider three axes in the space. One is the superior-inferior axis, another is the antero-posterior axis, and another is the medial-lateral axis. To determine the side of this scapula, we need to imagine a midline like this. So if this border is closest to the midline, this becomes the medial border. And that border, which is far from the midline, becomes the lateral border. And the one on the above is the superior border. Also, this is the dorsal surface in which we can see the spinous process projecting like a shelf. And this is the costal surface, which is the smooth and concave surface. So, if we put the dorsal surface behind, this becomes the right scapula. Similarly, if we take this scapula, medial border, the lateral border facing away and the dorsal surface facing posteriorly, so this becomes the left scapula. For anatomical position, the coracoid process should face anteriorly, the costal surface should face medially, and the glenoid cavity should face laterally and antero-superiorly. So it stays like this. Talking about the surfaces, this one is the costal surface. It is shallow, concave, and it shows some ridges. The medial two-thirds of this surface gives origin to the subscapularis muscle, and the medial border gives insertion to the serratus anterior muscle, also known as the boxer's muscle. Now, this is the dorsal surface. It is marked by the presence of the spine of scapula, which divides the surface into a superior, smaller supraspinous fossa and an inferior, bigger infraspinous fossa. These two fossa communicate with each other by a narrow notch called the spinoglenoid notch, which allows the passage of suprascapular nerves and vessels. The lateral border of this surface gives origin to two muscles, teres minor above and teres major below. Similarly, the inferior angle on this surface gives origin to latissimus dorsi muscle. Talking about the borders, this is the medial border. Since it is closer to the vertebral column, this is also called the vertebral border. This border on the ventral surface, as previously mentioned, gives insertion to the serratus anterior muscle. The same border on the dorsal aspect gives insertion to three muscles. Above the spine, above the level of the spine, levator scapulae, at the level of the spine, rhomboid minor, and below the level of the spine, rhomboid major. This is the lateral border. Since it is closer to the axilla, it is also called the axillary border. On this border, we find an infraglenoid tubercle just below the glenoid cavity. And the rest of the border gives origin to the teres minor above and teres major below. This is the superior border. It is the shortest and thinnest border and it bears a suprascapular notch. This notch is converted into a suprascapular foramen by a transverse scapular ligament, and the suprascapular nerve passes through the foramen and suprascapular vessels pass above the ligament. Also, there is the origin of the inferior belly of omohyoid muscle near the medial lip of the suprascapular notch. Now we'll talk about the angles, starting with the lateral angle. This is the lateral angle, which bears a shallow cavity called the glenoid cavity. It is covered with the articular cartilage. Its margin gives attachment to a fibrocartilaginous rim called the glenoid labrum, which deepens the cavity. This articulates with the head of the humerus, forming the glenohumeral joint or shoulder joint. There is a presence of supraglenoid tubercle just above the glenoid cavity, and this gives attachment origin to the biceps, long head of biceps brachii muscle. The superior angle is at the junction between the superior border and the medial border, and the inferior angle is present inferiorly at the level of 7th rib. It gives origin to the latissimus dorsi dorsally. Talking about the processes, there are 3 processes of scapula. This one is the spine or spinous process of scapula. It is quite prominent and it is a triangular shelf-like projection on the dorsal aspect of the scapula. The posterior border of the spinous process is called crest of the spine, which has an upper lip which is continuous with the medial border of the acromion process, the lower lip which is continuous with the lateral border of the acromion process, and an intervening area. The upper lip and the intervening area gives insertion to the trapezius muscle, and the lower lip gives origin to the deltoid muscle. Now, this is the acromion process. The name acromion is derived from the Greek word akron, which means highest, and omo means shoulder. So, it is the highest point on the shoulder region. It has a medial border, a lateral border, anterior surface and posterior surface. The medial border on the anterior aspect bears an oval facet which articulates with the lateral end of the clavicle, forming the acromioclavicular joint. The rest of the medial border gives insertion to the trapezius muscle, while the lateral border gives origin to the deltoid muscle. This is the coracoid process. It is a bent finger-like projection just above the glenoid cavity. It is an important landmark because it gives attachment to various ligaments and muscles. Talking about ligaments, there are 3 ligaments. One is the coracoacromial ligament, coracohumeral ligament, and the next is the coracoclavicular ligaments. Talking about muscles, the superior medial aspect of the coracoid process gives insertion to the pectoralis minor muscle, and the tip gives origin to coracobrachialis and short head of biceps brachii muscle. Talking about ossification, it forms by endochondral ossification, and it has 1 primary center for the body and 7 secondary centers for different parts of the bone. Talking about the applied anatomy of this bone, there is a condition called winging of scapula, which presents as the prominence of the medial border of the scapula dorsally when an affected person tries to push against a wall. This condition is due to the injury of long thoracic nerve, which supplies the serratus anterior muscle, which is attached on the medial border. Thank you for watching.